Good morning. I am here with Erica Moore. She's an LVN. She is our administrative nurse at Acappella. We are talking again about the coronavirus and updates from last week. There has been so much information on the news, and it's good to have a nurse's perspective on things. And who better than having Erica with me again? She is one of our best nurses. We have a big staff of over 450, and I would put Erica in the top 2. She does a great job. So let's talk about what's going on with the coronavirus right now. And what are the numbers, Erica?
The current numbers, and these are from yesterday, so these are probably even updated as of today. And so right now we're looking at in about 114 countries, over 110,000 cases, and then there's been more than 5,000 deaths from the new coronavirus. And this is one thing to keep in mind is this is not the same coronavirus that we've known of for years. The same coronavirus that's on the back of a lot of our disinfectants that say, it kills the coronavirus. This is something new, and this is the one that's being transmitted. It's a new strain from animals to humans, and so I just caution people to say this is not the same one that's been around. It's not the same as the flu, and there is reason to take caution and precaution. And so, but we've got some staggering numbers right now.
Well, I heard last night on the news that
Tom Hanks and his wife
now have the coronavirus, and
they're in Australia.
Mm-hmm. And the one thing that I think for me, I'm not happy that they have it, but I have a face to the virus
Right.
now. It's not a stranger. It's not somebody unknown. We hear the numbers of people, but just now that we know someone that has it, it gives us perspective that it is hitting home. It's hitting someone that everybody knows.
Right.
And it's going to be interesting to follow how he and his wife are feeling and what's going on. And tell me just a little that about Tom Hanks and what happened.
Well, I was going to say the interesting thing and the only thing that I really know is what he posted himself on Instagram, and it's that they weren't really sick. He said they didn't feel good. They had some fatigue, and so they went ahead and went to their doctor there in Australia, and they were told them their symptoms. They went ahead and got tested. Really not thinking they had it, and they actually tested positive. So that puts a little different spin on it. I mean, yes, Tom Hanks is a little bit older. We won't say how old because that dates us all. But we wouldn't really put him in what we call a geriatric population. He is generally of good health, and so is his wife. So it just kind of changes the dynamic of what we know and what we're continuously finding out about this new strain that's being transmitted from animals to humans and now amongst humans. And so it's just one thing is that the John Hopkins has been doing a study, and they're saying that the median incubation period of this new strain of coronavirus is 5.1 days. So they're saying that the incubation period, meaning you could be a carrier. Mm-hmm. So in 5 days, think of all the places that you could potentially go and expose people and not know it, and you don't have symptoms, you don't have a cough, you're not having shortness of breath. So the symptoms can be mild, or you cannot have them while you're carrying it around. That's why they're saying that if you've been on a plane, if you have any kind of, it doesn't mean that that the plane had to be coming from Wuhan, China. If you've been on a plane, then take those precautions. Even if it's from California, there's, I think, the largest number of U.S. Diagnoses right now are in California. And, stay away from people. But it's, yeah.
And let's talk about the NBA. I know they halted the season, or put a hiatus on the season, and one of their players has tested positive.
Absolutely. What I found out yesterday is that the NBA actually said until further notice, they have halted all games, which some would think is very drastic. However, one of the players has tested positive, and to my understanding, they have not issued the name, so I can't say the name or the team. But if you think about it, those players are on planes there, and then you get any one of those players in that 5-day incubation period, and you get them in an arena full of people, and then you just mass spread it. So I think that just from my personal and professional perspective, is that was very intelligent of those to make that decision until further notice. And you never know. I mean, there could be more positives. But again, I think that unfortunately, it being in the Tom Hanks and in the NBA, it gives us more of a face to it. It's not some, outlying person in an outlying country or state, and it just brings it home to a certain degree. And so it's definitely something people need to pay attention to.
Well, and I read in a study, news article, that 80% of the cases that are positive are very mild. So only 20% are those that turn into pneumonia or death. And those are the majority are our senior population. And
Right.
that's what we do, is taking care of seniors. And so we want to take every precaution for our senior community. And let's talk about what's going on. We have patients in the home. We also have them in skilled facilities, in senior living communities.
Right.
And unless absolutely necessary, we are prohibited from going into these communities. And
Right.
tell me your thoughts on that, as a home health nurse, we go from home to home. We might see a patient in a home, and then we have a visit to go do a patient in a senior living facility. So that does, any person we're in contact with, we're going to spread those germs to the next person we're in contact
Right.
with, unless we're doing good hand washing.
Right.
So talk about, what are your thoughts on what's going on in the senior communities?
Well, I think there are a lot of the communities are taking very good precautions. I don't want to say extreme, but I think they're great precautions. They're saying, you know what, if you don't have a real good need to come in and see our residents, because we do hold them liable. We do hold them accountable for making sure that these seniors are kept safe and they're kept well, and anything within reason can be prevented. And so, them saying, I know we do supervisory visits for our clients and making sure that our staff is doing what they're supposed to be doing. And so, maybe we have to delay. Maybe we have to talk to that staff member on the phone. I know that we've been doing a lot of communication with our staff, making sure, reminding them to, wash their hands for the 20 seconds, making sure that, if you're doing anything, don't interim touch your face with your hands. A lot of precautions also are to wear glasses and not contacts. I have contacts and haven't been wearing them during this period of time. And so they're just, as long as we're all doing those things. And I think not having contact with those senior communities and keeping them to a certain degree, keeping them in a quarantine is going to keep them safe. And I think that that's an incredibly smart move on those communities' parts.
And what's so great is with delivery services now, you can get your groceries delivered, you can get
Right.
medication delivered, and if you're in a city that doesn't have that service, just ask. I would
Absolutely.
feel sure that, a pharmacist would be willing to send a staff member to drop off something in the home if that senior that has those compromising conditions is not comfortable leaving the house.
Absolutely. And these days, I mean, you can just about have anything delivered. And if you don't want to see that person, if you have just a fear of what this is, which I don't think there needs to be a true fear, but I think we need to have an understanding of what's going on, and just be proactive about it and not be inactive. And that's one of the things that the World Health Organization, that's why they upgrade it to a pandemic, because it is a worldwide spread. And they're a little surprised at the inactivity of people doing, proactive things and staying away and hand washing and, quarantining ourselves or each other, if we've been exposed to anyone that could potentially have it. And it sounds extreme, but you have to sometimes go to some extreme measures to be able to contain it. And right now we are at the stage where we can contain it. We do have the ability to control this. And so, if someone's delivering your package, or your medication or anything that you need, have them leave it at the front door. You can always leave it there for 5 minutes and then go pick it up. And if you are one of the few that were able to get the stock of wipes and hand sanitizer, I mean, you can clean it. But I think taking those precautions is warranted right now.
I totally agree. Well, I did find an article about reasons for optimism, and I know nobody feels optimistic about a virus that's in a pandemic level. But the good news is we do know what it is. And looking at remembering AIDS, it took 2 years for then the scientists to identify actually what the virus was. With Ebola, it came to the United States, a couple of people, they contained that in Africa. And so we are working hard. We know how to detect the virus. And the great news, the situation is improving in China. The number of new cases is declining. So that is good news for all of us. One thing too is scientists all over the world are working on this. It's just not our American scientists. It's scientists all over the world. So we want to, we want to control this. Another thing is the good news is people heal from this virus. Coronavirus, it is 13 times more cured cases than there are deaths.
Right.
So again, 80% have mild or little symptoms. So that is good news.
Right.
As far as symptoms appearing in children, only 3% of the cases are under the age of 20. That's good news too. Another thing I read is this virus can be wiped clean with alcohol and hydrogen peroxide in 1 minute. So that was real interesting. I found that. But again, the most important thing, frequent hand washing with soap and water. 20 seconds, really get and dig in there, dig in your fingers and your nails. And just that 20-second rule on hand washing is so vital. Another thing that we need to feel optimistic about is there's already a vaccine prototype. So they are working diligently on finding a vaccine. There are also 80 clinical trials that are already underway. So we are working hard in the senior community to keep our people safe. The country, scientists around the world are working hard on finding trials, and we are working globally to combat this.
Absolutely.
So that's really good news. Anything else you want to share?
I just think, Joe, is just urging people to take it seriously. It's not where I'm not encouraging people to have a fear where, I've seen pictures of where the shelves are just cleaned out of toilet paper and sanitizer, and there's price gouging on those things. I think that's the extreme. But I do want people to take it seriously. Like I said, this coronavirus is new. This strain is new. This is the seventh type of coronavirus that has evolved, and that's where it got its name, COVID-19. But take it seriously. Don't just say it's just like the flu and just keep going. I mean, you need to make sure that we say wash our hands, but everyone doesn't wash their hands as much as we do as nurses or as healthcare professionals do. So reiterating that, we just can't do it enough. And stay away from, if you've traveled or if there is someone, maybe they even haven't traveled, but they're sneezing, they're coughing, stay away from those people. They have a fever. Those people need to stay home. Typically, we have, even in the workplace, you have a fever, you're coughing, you're like, oh my God, I've got to go to work because if I don't go to work, I'm going to get some sort of infraction. And people need to sacrifice that infraction and you need to stay home because you're putting people at risk. And you don't, I mean, there's not going to be, unless you go get specifically tested for coronavirus, you're not going to know if you have it. And so it's just taking those precautions, and that's the only way that we're going to be able to stop the spread of this. And I think that's where China, they were able to stop it because they said, okay, no more travel. And they really locked down and they took it seriously pretty quickly.
What do you think about the ban of traveling to Europe that President Trump just implemented that starts tomorrow, or it starts today, actually? What are your thoughts on that?
Absolutely. I mean, again, if we have to lock it down, lock it down. I think that's the only way. That there's always ways around everything. But I think the only way we're going to stop this from making it a true worldwide actual pandemic is if we take it seriously, we lock things down. I don't think Trump was unwarranted with saying, okay, halting flights, because those that can't come out of China, they're just going to a different country and they're just exposing more people. So if you stop that avenue, then it's okay. Well, I'm not going to go to Europe and try to get over because those flights are canceled too. But we have to take every precaution that we can to keep everyone safe.
Well, and our HR director at Acappella had planned to go on a cruise in the next couple of weeks, and she canceled her cruise, and she was on the phone holding, I don't know if you heard about this, for like 3 hours. She was on hold. So I would recommend not going on a cruise.
Right.
You're in that confined space. I think, if you do have travel plans, airlines, people are going to work with you. You just want to be careful and smart,
Right.
and we don't want to be exposed, and we certainly as nurses don't want to expose others.
Absolutely.
So thank you so much. Right now, Erica, looks like there are 21 cases in the state of Texas. We want to keep that low. Thank you, Texas, for doing what you're doing. Thank you for everyone that is working so hard to get this virus controlled. And we just want our clients and our seniors to be safe. And what better way than to listen to these tips that Erica's provided? If you have any questions and want to speak with a nurse, we're always available. Joe, Erica, we have other nurses on staff. Just if you have some questions that we might be able to help you with, our office is 214-866-0085. We have a website, acapellainhomecare.com. We're here for you. And thank you, Erica, so much for your time.
Absolutely.
Thank you.